Hello, I'm Dr. Salunkhe, consultant obstetrician and gynecologist, Sahyadri Hospital's Annex, MomStory, Hadapsar. Today we'll be talking about a very important topic, which is women's cancers, especially the gynecological cancers in women of all age groups. In gynec cancers in women, the reproductive organ cancers are very common and they can be treated and prevented if there is an early screening and if we can detect the cancers at a very early age, very early stage. The various cancers which are there are cervical cancers, that is cancer of the mouth, that is the cervix. Then the cancer of the endometrial lining, which is called the uterine cancer. The third type of cancers are the ovarian cancers, which are the cancers of the ovary. Ovaries are the organs which are on alternate sides of the uterus. The fourth and the fifth cancers which I'll be naming, the vulvar cancer and the vaginal cancers, are not very common, but of course in the enumeration these cancers are also there. Various other women's cancers like colorectal cancers, breast cancers are also very common, and it is very important that we screen all these type of cancers and catch them at a very early age. Now let's talk about cervical cancer. The cervical cancer is one of the easiest cancers to screen and prevent. How do we screen and prevent cervical cancers? By doing regular pap smears and HPV DNA checkups. The genesis of cervical cancer, as everyone knows, is the human papilloma virus or the HPV virus, which is transmitted sexually and also by skin to skin contact. When we are checking the patient in the OPD, we screen for cervical cancer by doing regular pap smears and doing the HPV DNA. Nowadays, the cervical cancer vaccine, which is called the Gardasil vaccine or the Cervafix vaccine, is a very common vaccine which is taken, usually it should be taken by all women in the age groups of 26 onwards. The vaccine ideally should be given before puberty, before the sexual contact starts. This is a very good preventive measure for cervical cancer vaccine. The other vaccine which is seen in the later age groups is the uterine cancer vaccine, that is the cancer of the body of the uterus or the endometrial lining. This is seen usually in the perimenopausal and postmenopausal women. The screening of this cancer is difficult, but the symptoms itself warrant regular screenings with the help of sonographies, the abdomen and the pelvic sonographies. Here the patient would present with abnormal uterine bleeding in the perimenopausal or the postmenopausal age group, in which definitely we would take preventive measures and definitely radical measures too, by doing DNCs and hysteroscopies to detect the cancer in the uterus, and later on the treatments like hysterectomy. The third type of cancer, which is a cancer which has it is more dangerous, is the ovarian cancers. There are many types of ovarian cancers which are there. They may be found in any age group, right from the reproductive age group to perimenopausal age group. They may be associated with alarming signs and symptoms like bloating, the distension of the abdomen, and ascites, which is the water levels in the peritoneum in the abdomen increase, and they are very quickly spreading cancers, ovarian cancers. So it is very important that we screen by doing regular sonographies, and if there is a history of cancer family syndrome, which is also called the Lynch syndrome, in which there is some mutational genes which are affected because of some mutation in the genes, and the cancer family syndrome, which is called the Lynch syndrome, is associated with other cancers like the breast cancers, colorectal cancers, leukemias. So if there is anyone in the family who is suffering or has a genetic history of such cancers, then it is very important to prevent and screen for ovarian cancers by doing some blood markers and sonographies, and in some cases some drastic measures and screening methods have also to be adopted very carefully. So the other cancers which are there, vulvar cancers and vaginal cancers, are nothing but growths in the vagina or the vulva. As I said, they are not very common, but definitely regular checkups from the gynecologist every year is mandatory. So I hope this has been very beneficial talk for you for the screening and prevention of cancers of the genital tract, and I hope all of you will visit the OPD from time to time to get yourself screened from these cancers. Thank you so much. I'm Dr. Mini Salunkhe.